Hello, welcome to our online course on patient satisfaction assessments. My name is Patricia Blackburn, and I am a Vice President at CARDIA. On behalf of the California Primary Care Association and CARDIA, we are pleased that you have selected this module to support your professional development. CARDIA is a nonprofit, mission-driven organization with a principled team of committed and passionate staff who have dedicated our careers to helping health and human services providers offer their best to their patients. You may be aware that CPCA is offering this course as part of their Patient-Centered Health Home Recognition Program. This Patient-Centered Medical Home Recognition Program is an initiative for CPCA's member clinics to support their efforts to achieve Level 3 standards of the National Committee for Quality Assurance Recognition. For more information, go to the CPCA website listed here. I'd like to quickly review some terms for this session. I will be using the terms healthcare provider or provider and healthcare staff interchangeably throughout. For this topic, we're really talking about all levels of staff. Assessing our patients' satisfaction with the services we provide has been a long-standing practice among most health providers. The new term that is being used for very similar assessments is patient experience rather than satisfaction. Throughout the course, we will be referring to the patient's satisfaction, but keep in mind we're assessing the patient's experience and their satisfaction with that experience. Let's go on now to the objectives we hope to accomplish in the course. There are 3 objectives for this course that will give you a sense of what we're going to cover. These are the things we hope you'll be able to do as a result of participating in the course. First, you'll be able to describe the key elements to conducting patient satisfaction efforts. During the course, we'll discuss who and what and when and where and how to plan and carry out patient satisfaction activities. Secondly, we'll review various data collection methods so you'll be able to see what your options are and how to implement one or more of those approaches. And finally, we'll spend some time discussing how to analyze the data once you've collected it. Analysis will vary depending on the data and information you collect and how you go about collecting it. We'll also discuss what to do with the analysis, how to use the results to plan improvements or changes in your systems and practices. Before we get into the what, how, who, when, and where of patient satisfaction activities, let's talk about the why. The big question is, why should we care? Why do we want to assess our patient's satisfaction? Think for a moment why patient satisfaction is important. Even though you can't share your thoughts with us, I'm sure you have some ideas of why it might be important or useful to ask your patients their opinion about the care you provide. So pause the course for a moment and jot down some of your reasons. I hope you came up with a few ideas of your own. Here's a few reasons we came up with for why we conduct these type of assessments. For one, the Patient-Centered Health Home program requires that healthcare providers measure and improve performance. One of the specific areas that's required to be measured is the patient's experience or satisfaction. Another reason is that the feedback we get from patients usually helps us to see what we're doing well, what we could do better, or how the services could be improved to be more satisfying to our patients. A couple of other reasons are that patient satisfaction efforts will help us identify what our patients want as opposed to what we or other staff members think they want. That's pretty important, don't you think? Since the patient's desires strongly influence their experience and satisfaction with the service. Patient satisfaction data will also provide feedback to everyone, all staff, the board, and the community. It will give us specific feedback on how effective our programs are. A couple of more reasons include getting information from patients will help us evaluate how effective any new programs, practices, or changes are from the patient's perspective. Did we accomplish what we hoped we would accomplish with this new program or change? Input from patients also provides us the opportunity to develop proactive responses to emerging client needs. In other words, satisfaction information on emerging demands from patients is really our crystal ball into the future. Patients don't judge clinicians and other medical professionals on their professional competence or knowledge. They base their appreciation and approval of clinics and clinic staff on how well they are treated. That's the good news. We can control that. Maybe you think it's not so important to care about our patients' experience because our patients are a captive audience, right? They're really not. Especially with the Affordable Care Act, ACA, Obamacare, whatever you want to call it, patients will have choices about where they access at least some of their care, and we want to keep them coming back to us. ACA's pay-for-performance measures are in part based on patients' perceptions of care. Your clinic can literally lose money in insurance reimbursements over poor patient assessments. Still not convinced? Here are some more reasons to keep patients happy and coming back. So those additional reasons include that the cost of acquiring a new patient is 5 to 7 times greater than retaining current ones. For every one customer who complains, 20 dissatisfied customers do not. The average wronged customer will tell 25 others about the bad experience. So clearly, assessing patient satisfaction and then acting on what we learn is important. Now let's look at a systematic approach to doing just that. You'll see with this slide that the process is circular and continuous. The first step is to form a staff work group to focus on planning and conducting your patient satisfaction process. Tools for data collection will be selected. All staff will be included in the process to support the data collection and discuss results. We'll collect the data and analyze what we found. Our final and most critical step will be putting the data to work. If we don't use what we find to make changes or improvements in our services, we've wasted everyone's time. Be sure when you make changes and improvements that patients know that those changes are based on their feedback. It will encourage their participation in patient satisfaction efforts in the future. We'll now discuss each of these components separately so you'll know how to conduct your own patient satisfaction activities. The first step is forming a work group. The first step is to form a staff work group. You've probably all been part of a work group at your organization. We're talking about work groups in detail here to outline the most effective way to be successful with a work group. The question is, why do we want a work group? Here's a few reasons. With a work group involved, it will reduce everyone's fear of asking for patient feedback. It's a better process when diverse staff are involved because it provides a range of perspectives, it communicates to all staff that management is committed to this endeavor. A diverse work group can establish more credibility than merely having managers or administrators involved. And finally, the diversity will result in more comprehensive and creative solutions and ideas for problems that are identified. Some things to keep in mind when forming the group include that the size should be about 5 to 10 maximum, depending on the size of your organization. The group should be big enough for real teamwork, but small enough to make decisions and to get the job done. Creating and maintaining a patient-friendly clinic is everyone's job, and everyone includes managers, clinical providers, and clerical personnel. Therefore, the work group should be made up of experts representing all the different roles in the clinic. The selected members should be respected by their peers and have leadership qualities. And finally, you want staff with a variety of skills, those who are deep thinkers, staff who are detailed people, and some high-energy staff. How we communicate with staff about the work group is important. We want staff to understand that this is an honor, and that their work is important, and that this is going to be an interesting and exciting effort. We're going to send an invitation. We're going to tell them that they're invited to join this group. The invitation will tell them that this will be a fun, challenging, creative, and rewarding endeavor on providing great patient care. We'll also include the time and date of the first meeting. To set the tone of the rest of the effort, the first meeting of the work group is critical. Here are some important considerations: the room setup, the supplies we have, an icebreaker, and a facilitator. For the setup of the room, place the chairs in a circle around a central table, preferably not a conference table, but if that's what you've got, work with it. On the table, place some items that symbolize client satisfaction and staff involvement. Items might include gold stars, a good job sticker, a simple but fun hand-lettered sign that says, "Your opinion counts," a report card, some previous client satisfaction tools your agency has used, a suggestion box, or whatever you think of. Be creative. The supplies you need are items to stimulate creativity and infuse a sense of playfulness into the room. Visit a local craft store for inexpensive items such as colorful pipe cleaners, colored paper, a rainbow of pens and markers, toys, and other simple objects. If at all possible, provide drinks and snacks. It's hard to focus on an empty stomach, and food is the best and simplest way to break the ice. The facilitator or leader of the group is critical. The facilitator must arrive first to set up the room and to greet participants. Each individual should be greeted warmly and personally. They should be welcomed and encouraged to take a seat and play with the items you've set out. When everyone has arrived, ask what their ideas are about the unusual items and explain that they're there to be. The work group has several basic decisions and roles to play. First, they need to decide what they want to look at or learn about. The literature indicates that the basic areas of most concern to patients are people skills, which is the communication between staff and patients. Patients are also concerned about the ease of getting in for care and receiving care. They are concerned about the environment and amenities of the facility and the continuity of care. Some of the other issues that the patient-centered health home requires groups to assess are coordination of care and whole person care self-management support. Obviously, there is lots for us to learn about, lots of what's. Next, we need to decide how we want to learn about these issues. What methods will you use to gather patient feedback? There are a variety of approaches that we'll discuss shortly. We also need to think about who is going to do what. Depending on which tools you choose, different tasks will need to be assigned. For example, if you choose surveys, the receptionist will not only hand them out to clients, they'll also explain them and encourage clients to complete and return them. If you choose focus groups, who will lead the groups? Who will take notes? Who will transcribe the notes? You get the picture. The other roles of the work group include deciding what the data is telling you. Once the data is collected, it has to be interpreted so it can be put to work. That's the analysis. The group will need to decide how they'll share the findings with staff. You might create a colorful bulletin board for the reception area filled with positive comments, or hold a staff meeting to share the data and ask staff what they think should be done about it. Finally, the work group takes the lead and ensures that the staff plan and take action to respond to those issues that are most dissatisfying to patients. They may also have responsibility to assess the results of the actions. Did the changes that we made improve patient satisfaction or not? There are three main methods for collecting data from patients. One is interviews or oral discussions. Another is written questionnaires. And finally, ongoing input is an option. The three types of interview methods are in-depth interviews, patient focus groups, or shorter exit interviews. The advantages of the interview method is that you get to talk to patients, you get to ask clarifying questions, and you get to probe for more details. Patients are likely to share honest opinions if an interview or focus group is done correctly. This is called qualitative feedback because it's people talking with you rather than just checking a box or circling a number. The disadvantage of the interview methods is that they are time-intensive to conduct, compiling the information in a sensible way is more difficult, and analyzing the data is also somewhat more challenging. You also need qualified people to do the interviews or to run a focus group. We want to note that in order to become a patient-centered health home, you do need to utilize some sort of qualitative feedback method, like interviews or focus groups. You can also do an ongoing input method like a suggestion box to get the qualitative feedback. I think as a good practice, I would recommend doing 1 to 2 focus groups a year with selected patients. It's a way to meet this requirement and to get the richer, fuller feedback about your services and operation. We're going to discuss some of the reasons why we suggest focus groups and give you more details about how to do them as we move through this course. So why do we do focus groups? They're a chance to draw on the participants' attitudes, feelings, beliefs, experiences, and reactions that are more readily expressed in the social atmosphere and interaction of a group. Some more reasons we do focus groups are to get more in-depth information than is possible on a survey, and it's a way to gain a larger amount of information in a shorter period of time than individual interviews or observations. Consider using focus groups to follow up on survey results. This is especially useful if a significant number of respondents have expressed dissatisfaction with something about your site and you want to learn more. Another instance when it might be helpful to conduct a focus group would be if the organization is doing long-range strategic planning about changes or additions to services, hours, or locations for services. One of the key factors in the success of a focus group is the moderator. The moderator must encourage interaction and honest responses. They also need to keep the group on task. Effective moderators use excellent group facilitation and communication skills, especially in establishing rapport and asking open-ended and follow-up questions. If no one at the site has ever led a focus group, a volunteer from the community may be available to lead the first group. You can check with a local university, health department, or a volunteer agency in your community to find a volunteer to be your focus group moderator. When you're conducting a focus group, someone besides the moderator needs to take notes. A note taker must be very skilled in capturing what participants actually say, as well as summarizing when appropriate. Focus groups can also be taped and the conversation transcribed later. As far as the resources needed to conduct focus groups, the greatest investment will be the staff time to plan for, conduct, and follow up on the information from the focus group. Other resources include paper and pen for the note taker, or a laptop computer, and possibly a digital recorder. A comfortable private space, preferably in a neutral location, is important. Refreshments and some simple incentives always help. If participants are parents, you should consider providing childcare. If the focus group members include adolescents, you may want to consider providing transportation. Some people think that asking patients to participate in a focus group would be a burden on them. However, participating in a focus group may be an enormous benefit to the attendees. They may see it as a great opportunity to be involved in the decision-making process. They're being valued as experts, and they have a chance to work collaboratively with providers. The first consideration in planning a focus group is the number of participants. The group should be small enough for everyone to have an opportunity to share insights, but large enough to have diverse perspectives. Usually you'll need at least 4 people, but no more than 10. You'll need to prepare the questions you will ask the group in advance. When developing questions, consider what is the goal of the focus group, what you want to learn from participants, why you're doing a focus group instead of individual interviews or another method. Be sure that every question that is asked feeds back to the goal and that there is a plan for using the responses to that question. If it is unclear why the question is being asked, don't ask it. Regarding the questions that are prepared ahead, you should develop 5 to 6 questions before the focus group occurs. Use open-ended questions and avoid yes and no answers. During the focus group, use probing follow-up questions like what influenced your answer, or please say more about that. Also during the session, encourage alternative points of view, like asking does anyone feel differently, or what are some other points of view. When actually conducting the focus group, welcome and thank participants for being there, provide an overview of the topic of discussion, establish some ground rules like one person speaking at a time, discuss that the answers will be kept confidential, be clear that there is no right or wrong answer or good or bad answer, and finally, encourage various points of view. Now that we know how to do focus groups, we'll move to other methods for patient satisfaction efforts. The other methods for collecting patient satisfaction feedback are not face-to-face like those we've just been discussing, but involve some type of questionnaire. The questionnaire can be done by mail or electronically, on the phone, or as part of the patient's visit. There are advantages and disadvantages for every data collection method we're discussing. For questionnaires, the advantages are that they tend to be inexpensive, you can ask about specific aspects of your services, and the data is easy to compile and analyze. The disadvantages of questionnaires are that phone, mail, or e-surveys could breach patient confidentiality. Other issues are literacy or language issues for those completing the questionnaire. So where do you get patient satisfaction questionnaires? You can purchase satisfaction instruments offered by private vendors. A couple of vendors with instruments are Press Ganey or the National Research Corporation. Or you can access publicly available standardized patient satisfaction instruments. The most talked about publicly available tool currently is the Consumer Assessment of Healthcare Providers and Systems, or CAPS, which is a program that is a multi-year initiative of the Agency for Healthcare Research and Quality. We'll talk a bit more about the CAPS tool in a moment. Some sites or organizations also create their own questionnaires. The CAPS surveys are designed to support and promote the assessment of consumers' experience with healthcare. The goals of the CAPS program are twofold: develop standardized patient surveys that can be used to compare results across organizations and over time, and to generate tools and resources that produce understandable and usable comparative information for both consumers and healthcare providers. All CAPS surveys are in the public domain, which means that anyone can download and use these surveys. The various CAPS surveys ask consumers and patients to report on and evaluate their experiences with healthcare. They cover topics that are important to consumers and that consumers are best qualified to assess, like communication with providers and staff and ease of access to healthcare services. Some of the surveys focus on the patient's experience in the last 12 months, while others focus on the most recent visit. Many questions are focused on the care and communication with the healthcare provider, in other words, physicians, nurse practitioners, or physician assistants, rather than any other clinic staff. The reason we're talking about the CAPS surveys is that one of the criteria for qualifying as a patient-centered medical home is Standard 6, which is Measure and Improve Performance. Element B under Standard 6 is to measure the patient and family experience. In order to meet one of the factors under Element B, the practice must use the standardized CAPS survey. The specific survey to be used is the Patient-Centered Medical Home Survey Tool. Here are some sample questions from the required CAPS survey on patient-centered medical home. As you can see, the answer choices are never, sometimes, usually, and always. The 2 questions listed here relate to the patient's success at getting the appointment they needed when they wanted it. Here are some more sample questions from the required CAPS survey. These questions relate to the patient's most recent visit. In general, the CAP surveys tend to be rather long, usually about 50+ questions, though they're easy to answer, as you can see. The other limitation on these surveys is that they don't collect any real in-depth information from respondents. All the CAP surveys and information are in PDF format and can be accessed using a free Adobe Reader viewer. The various types of surveys include a 12-month adult survey, a 12-month child survey, a most recent visit for both adults and children, and then there are supplemental questions that can be added to any survey that focus on cultural competence, information technology, and some patient-centered medical home issues. In addition to the surveys, the CAP's website has guides on preparing a questionnaire, guides on preparing and analyzing the data. They have sample notification letters for written mailed surveys and telephone scripts. All of this is available free of charge at the website listed on the slide. As we mentioned earlier, many clinics create their own patient satisfaction surveys so that they can tailor them to their patients and their areas of interest. So let's spend a little time talking about how to design surveys that will really tell you what you want to know. The first rule of designing a questionnaire is KISS. Keep it simple, sweetheart. But how do we do that? To start, we should keep in mind that patient surveys should be done periodically, not continuously. They should be kept short and easy to complete. And if they're done at a visit, they need to be distributed and promoted by staff. Any questionnaire should be focused. You need to choose one area that your work group decides it wants to hone in on. It may be something that a funder has suggested you look at, or based on a previous patient concern. Or it may be an area that you have an opportunity to expand and need to know more about exactly what your patients would like. Here's an example. Let's say you want to find out about efficiency. You could ask patients how they would rate any of the following 6 questions, which will provide you a great deal of information about how your patients feel about how quickly they're being served, quickness of staff, readiness of staff, waiting time, etc. Here's a guide to what your survey questionnaire should include. First, you want some demographic information. Obviously, you want some information about the people completing the survey. These can be asked at the beginning or end of their visit. We probably want to know the person's gender, maybe their age, their race, ethnicity, or whether they are a new or a returning patient. You can ask any question you want that's about the person answering the survey. Another great tip is to not just ask how satisfied patients are after their visit, but to solicit patients' expectations as well as their satisfaction. Without asking about expectations, we have no way of knowing what's important to our patients. To do that, we ask expectations before the visit. These questions can be phrased, how important is it to you that? You would specify a particular area that you're focusing on, whether it's communication or access or the facility itself, whatever. We'll look at some examples in a moment. Then after the visit, satisfaction questions would be asked and phrased like, how would you rate? Again, the things you would list and ask patients to rate would focus on your area of interest. And again, we'll look at a few examples in a moment. One more thought about asking expectations before the visit along with satisfaction after. By asking patients how important specific elements of their care are to them, we can then use their expectation scores as a baseline for comparing satisfaction scores. Like the graph on the screen, dissatisfaction is indicated if a satisfaction score is lower than the expectation score. Here's an example of an expectation question about the access or efficiency of services. Patients would be asked, how important is it to you that the clinic visit does not take too long? Then the patient gets to circle their answer, 1 being not at all important, 5 being very important, and you see the other choices in between. The The satisfaction portion of this questionnaire could use the same example satisfaction questions about how efficiently patients received care that appeared on a previous slide, adding a rating scale of 1 to 5 with the categories that you see here, or checkboxes so that the client can complete the form in moments by simply circling numbers or checking a box. Here's another example. One clinic we worked with wanted to learn how patients perceived their environment. The question about expectations on that survey was, how important is it to you that the clinic is in good condition? The average score from patients during this survey period to this question was 4.23, or important. The satisfaction questions that were rated by patients for this same survey are shown on the slide. The responses or ratings on all of the questions were lower than the expectations. The highest rating was on the response to the condition of the building, a 4.08, and the lowest rating was in response to the ease of moving around the clinic at a 3.68. Remember, the expectation score was 4.23. This comparison told this clinic exactly where their patients' expectations weren't being met, and the staff were able to address some issues and problems in these areas. Pretty useful feedback, don't you think? Here's another example related to the importance of communication. The expectation question could be, how important is it to you that the staff and providers have good communication skills? Possible satisfaction questions could be, how would you rate how often you received an answer to a medical question that same day, the provider's ability to listen to you without interrupting, the time it takes to receive lab results, the front office staff's ability to keep you informed about wait time. Again, you'll compare the satisfaction scores with the expectation scores to see where you need to make improvements. It's essential that staff are involved in the survey process. This is where your work group comes in. Having someone representing several different clinic areas means that they can advocate with their peers about helping with the surveys. Staff involvement leads to getting honest responses from the highest number of patients. Staff is key. Here are some critical staff roles when your site is doing survey activities. Involve staff in handing out surveys. Staff should be able to explain the survey and convey enthusiasm about getting feedback. They might say, we're anxious to hear your opinions about our services. We're doing a quick survey with all our patients today. If you could fill it out for us, we'd really appreciate it. It won't add time to your visit, I promise. Obviously, the staff would need to actually hand the survey to each client, and it needs to be in the correct language for that client. Staff should tell patients to complete the first part of the survey prior to being seen. The first part can be the demographics and the expectations, and that they should complete the last part after the visit. Sites need a locked box set up in a secure place where patients can return their surveys. It needs to be away from staff so it will be anonymous. The staff handing out the survey should tell the patient where to leave their surveys at the end of their visit. Overall, the work group should watch return rates. What percentage of the patients who came to the clinic today returned a satisfaction survey? If it's below 60 to 80%, they should check about how staff is giving out the surveys and how enthusiastic that staff is. Regarding how many surveys you need completed and by whom, there are pros and cons to each approach, as you'll see. Assessing everyone for a limited period of time makes it easier for staff to follow the procedure and remember to hand out the surveys. You can also get it done quicker. However, the results may be doubted because of the limited time period of assessment. You can do the patient surveys episodically, like 3 days per month for 6 months. This approach is harder to carry out because someone has to remember when it's time to collect data. It also takes longer to complete the data collection. This approach, however, would likely quiet some of the doubts about the limited period data collection. You need ideally 100 responses or more to have enough data to analyze. For small sites, that could be difficult, and you'll just have to do the best you can. You may also want to oversample priority populations like adolescents or diabetics, or some other patient group. That's possible too, but a little less random than giving a survey to everyone. Here are some ongoing input mechanisms that can be used to get feedback from patients. You can have a toll-free number, a suggestion box, or a response card at the end of the visit. The advantages of these methods include that they are a good source for soliciting ideas and complaints. They also can be very inexpensive. The disadvantages are you're getting individual opinions, which do not necessarily represent the majority of clients. Here's one fun and more informal way to get feedback. Post large sheets of blank paper with a question on it and provide markers. The question here was, how can we make your waiting room experience better? This was done in a teen clinic in Washington State. We've talked most extensively about focus groups and surveys. We learned how to collect data from patients with these two methods, and now we'll discuss how you analyze the information that you've collected. To analyze your focus group data, which is qualitative data, your first step will be to organize or sort your data from each instrument or event where notes were collected into more manageable categories. All workgroup members should read through the transcripts or compiled notes from interviews. All members should be looking for common themes. You can start broadly and get more specific as you continue to review the data. One person should generate some themes from the responses and share them with the rest of the workgroup. Others should review and add ideas or comments to those themes. As you continue to reread the responses, you will probably see some patterns. To keep track of those, you can code them, which simply means you go through the data and label words or phrases that occur repeatedly. For example, if during a focus group, one person said their visits to the clinic were too long, and another person said they had to wait in the waiting room too much, and another said they hate being in the exam room undressed waiting for the clinician, you might label each of those phrases as too much wait time. As the team reviews the initial set of themes, you should also keep in mind where there are exceptions to those broader data. You'll need to create some sort of document that summarizes the results. During the last phase of the analysis, the work group has probably already started to think of next steps or come up with some ideas of possible actions to take to solve the patient's concerns. Next, we'll talk about how you compile and analyze qualitative results from questionnaires. To tally the answers for rated questions, there are a few steps to go through with each question. Let's go back to some of the questions we looked at earlier. Using a scale of 1 to 5, how would you rate the cleanliness of the clinic, the condition of the building, or the surrounding neighborhood? Here's an example of how a small sample of patients may have responded to these questions. This clinic is in pretty good shape, so out of the 15 people who responded, no one thought it was awful or bad, so you'll see zeros in those columns. Also notice that not everyone responded to the last question, so the total for question number 3 is 14 responses instead of 15. In order to get an average of all the responses for a particular question, it may be easiest to create a table with 5 columns, one for each rating like we've done here. You can see that we've transferred the number of responses to each rating for question number 1 to this table, and it's in that first row. The next step is to multiply the number of responses by the amount assigned to each rating, which we set up in row 2. So for example, 0 is multiplied by 1, 0 is multiplied by 2, 5 is multiplied by 3, and so on. The totals are then added together. For this question, our total is 67. The last step is to divide this total by the number of patients who answered this question. For this example, it would be 67 divided by 15, which equals 4.46. Therefore, 4.46 is the average score for this question. That's a really high rating of satisfaction. You'll need to go through this process with each question. Do not make the assumption that everybody answers all the questions. If you were to calculate the average score of question number 3, you would need to divide by 14 instead of 15. If you can calculate an average patient expectation score and an average patient rating of your site's performance, it is possible to identify which aspect of your services are meeting expectations and which are not. One thing to bear in mind is courtesy bias. Many patients express more satisfaction than they actually feel in order to be polite or because they are afraid of being identified. Therefore, when you review your scores, in addition to being very sensitive to slight differences between expectation and satisfaction scores, look for small or subtle expressions of dissatisfaction. How close are your satisfaction scores to the expectation scores? How high are patients' expectations? Are patient expectations too low or about right? When you review patients' comments, note if they add information about the questions in the area of focus you chose, or if their comments are about a whole other area. If they are about a whole other area, the next survey might want to focus on that area. Now that we've compiled our data, using the findings from these satisfaction efforts is the most important step. If you don't do anything with the findings, you might as well not do client satisfaction activities. This is also a chance to discuss the positive findings as well as the areas for improvement. Discussing the results from patient satisfaction efforts with as many staff as feasible is ideal. While written results may seem quicker and easier, presenting the data in person provides an opportunity to highlight key results and continue staff involvement and commitment to the next step of putting the data to work. This in-person sharing is also an opportunity to get staff input and ideas for the most important step in the process, what changes the site will make in response to patient feedback. It's up to you how you want to present the data. You can present it in text bullets or in a table format or in graphs, or all three. At this in-person meeting, the group should prioritize findings and ideas and then create an action plan. You've all done action plans. They require identifying what you'll do, how, where, and when you'll do it, and who's responsible. The why is what we hope to accomplish. There are some important considerations for action plans that you should keep in mind. For an action plan to be successful, it's important to have vision, skills, incentives, resources, and a well-done action plan. This will result in motivated staff and successful change. If some of those elements of successful action plans are missing, here are the potential results of those missing pieces and the possible solutions. You can read the table for yourself and see that in the left-hand column we have each of the elements and what the result is if they're missing and what the possible solution is to get them included. The last step in the process starts you all over again. Once you've instituted your changes, you'll need to conduct more patient satisfaction assessments to see if the change did what you hoped it would do. This concludes this session. Thanks for participating. We hope you'll find that the information is useful to your future patient satisfaction efforts. For other online training opportunities, visit the California Primary Care Association website or CARDIA's website. So goodbye for now, and thanks again for listening.